Hello again, everybody. Have you been told that you're too young for a hip replacement? When I was training nearly 30 years ago, we were told to avoid offering hip replacement surgery to younger people. The fear was that the implants wouldn't last and patients would face multiple revision operations over their lifetime, each one more difficult than the last, until eventually there'd be nothing more that we could offer. Back then it made sense. The materials that we used were fine for older patients, but for younger, more active patients, they simply weren't good enough. Fast forward to today, and things have changed a lot. Modern implants are far more durable and surgical techniques have improved, but what hasn't changed quickly enough is the way younger people are treated when they seek help for their painful hip arthritis. I recently read a paper called Young Hip, an exploration into young people's expectations following primary total hip arthroplasty. That's a total hip replacement. What stood out, they didn't focus on complications like revision rates or dislocation, which is what most papers look at, but on how younger patients actually experience hip arthritis and the care that they receive. It asked them, what does this pain mean to you? What's the impact on your life, and what do you expect from surgery? The answers were brutally honest and quite sobering. Patients said things like, I had to fight to get the operation. They're probably a bit apprehensive about giving a hip replacement to a 33-year-old. The most common theme? Well, that was pain, not just mild discomfort, but all-consuming pain that dominates everyday life. A patient said, I went to my GP about my medications, and she said, well, what do you expect me to do? There are also stories of isolation and loss of identity. I just want to sit on my own because there's nothing I can do, said one patient. Another one said, I used to be buff, but now my legs are like twiglets. Sexual activity came up repeatedly, especially for women, alongside a lack of information and confidence. One woman said, sex life? Forget it, that's gone out of the window. No one tells you what's safe or what positions are okay. These concerns echo findings from a study I set up years ago. We found that many women said that their sex lives improved after surgery, but that they were anxious about having a dislocation of the hip and wanted clear, sensitive guidance. It's still an area we don't talk about properly. Then, of course, there's the emotional toll of feeling like you're failing as a parent, partner, or provider. One of the patients said, it just feels like I'm not parenting well. I'm failing at my job. Several of them described struggling to get clear information or consistent care. Pathways are still geared towards older patients, which is understandable, so younger people fall through the cracks. They don't fit the mould, and they feel it. So what about me as a hip surgeon? Well, this study made me think a lot about how I treat my patients. By the time they get to see me, they're often been back and forth for months or years trying to get answers. They've been told they're too young, they've been dismissed or given conflicting advice. I take the time to understand how their condition affects them, not just physically, but emotionally, socially, and professionally. We explore the right treatment options. Sometimes that's a total hip replacement, sometimes a resurfacing. But it's not just about the surgery, it's about helping people make informed decisions and giving them a realistic picture of their recovery, expectations, and outcomes. If we agree that surgery is the right next step, I'll do it to the very best of my ability. And I'm really fortunate enough to work with a team who share the same values, people who understand what you're going through and who are there to support you throughout your recovery. If you'd like to get in touch, contact details are in the description below. Thanks for watching, and I'll see you all again next time.